A warm welcome to all our viewers to our series Natural Medicine. Today, once more, I'd like to hear and listen to again how a heavy metal detox works. Why should we even do a heavy metal detox? But I think not only heavy but also light metal elimination. Why is it so important for our health to focus on this? I'd like to discuss this again today with Dr. Petra Wiechel, the Chief Physician of the Swiss Mountain Clinic. Welcome, dear Petra.
Thank you.
Why? That's the first question, I think. Most of our viewers have heard it before. But I know marketing teaches us that they have to hear it 7 times before it really gets somewhere. Therefore, why should we, as a healthy person, put the focus on a detox?
As a healthy person, but also as a sick person at the latest, and the whole problem today of amalgam fillings is far from off the table. There are still people with it, which surprises me a lot, because word has actually got round how highly toxic amalgam is in the mouth. It is hazardous waste that must be disposed of as hazardous waste, and we just accept that it's there.
I took it out 10 years ago. Also did detox, but only with chlorella and spirulina. And now I can see my blood values from the professional detoxification. Everything's still there. Nothing was eliminated.
We talked about blood and that the body serves the blood. In other words, what does the body have to compensate for over the years and decades so that the blood is not affected, and for that it has to take care of the highly toxic heavy metals, for example, mercury, arsenic, lead, as so-called neurotoxins, which of course also have a strong impact on our health, our nerves.
But now the viewers might say, I don't eat it. How does that even get into my body?
Well, of course, I eat it too. For example, today, aluminium is found in a lot of food, or what we call food. It's such a big industry today, whether in melted cheese or in instant coffee, aluminium is used. This is a light metal with which the body can do absolutely nothing. And that's the cadmium, that's the car exhaust fumes, that's smoking. I don't want to put the smoker in the foreground anywhere. But you don't have to eat organic. You don't have to think about awareness and staying healthy when you smoke. And that's more than thousands of toxins that accumulate there every day, and that the body has to get rid of in some form. And that is the mercury alone. In the vaccinations, the thiomersal.
I'm just amazed, As a child, I knew mercury from the thermometer, and my mum always said, be careful not to break the thermometer. I was really made aware that mercury is poisonous.
That's the way it is, and it has a half-life of over 30 years. And I experienced how quickly that happens a few years ago, when a weather thermometer, fell off the wall, and the young girl had disposed of everything as a precaution, but only after a few weeks became so seriously ill that you could see how mercury vapours then just spread. She also slept in this room. And that was a period of only a few weeks to months until it reached a dimension in terms of health that was frightening for this 16-year-old girl who is healthy again today. But it took 1.5 years alone to be able to pursue this matter at all, which actually in the first 6 months was not even remotely associated with this small accident. I just want to say that we experience toxins every day today, consciously or unconsciously. We have over 275 medicines that contain aluminium. These are adjuvants in the vaccinations and so on. That is, this toxicity is so high that I'm really surprised, because we measure what the body has had to deal with for years or decades, and of course it manages to do it first and puts it away because it can't get rid of it. This is a silent danger, a really serious danger. because we also connect the development of autoimmune diseases, tumour diseases, neurodegenerative diseases very strongly with these burdens. Because we can see the course these diseases take. And I wonder why. Why aren't we more interested in such drainages if we then also do them after a dental restoration? Before that, it is also not possible. You can't remove toxins with a chelation. If there is still amalgam in the mouth, you would loosen that. But once it's removed, there's really a lot that needs to be clarified in the foreground. Is the body also capable of drainage? Because if the drainage is not possible, then you would deposit from left to right, because the liver has to do this job. And those are all very important questions to ask when you start such a week. For example, we design it as a detox week. Then these are examinations that I also put at the beginning in order to prepare a detoxification for this individual patient in the long term, which must be integrable. And of course, heavy metals are also eliminated in different ways. Arsenic and mercury are eliminated differently than lead, for example, and aluminium. These are all possibilities that the body has after binding these heavy metals from the connective tissue, from the thyroid gland. The deposition of heavy metals is very strong in the prostate, for example, and every prostate carcinoma is always preceded by prostatasis, an inflammation of the prostate, so that the content of this that's the content of this detox week.
So all gentlemen who are really having an elevated PSA level are actually also sensitised to think about whether they should also do a detox.
The diagnosis of a prostate carcinoma is made today by the PSA. That's when you become conspicuous. But you should see the PSA value as a biomarker, not as a tumour marker, and should above all take care about what is going on with stress that a prostate also has to compensate for. Because without inflammation, prostate carcinoma cannot develop.
But this PSA value is used as a tumour marker, isn't it?
I know that, but it's not an absolute tumour marker. Many people who do not develop a tumour also have elevated PSA levels.
Even cyclists, probably.
Yep, quite a lot. Even a man who is still sexually active may have elevated PSA levels.
Can we jump back once more? Back to the source of the cause. I've heard that mercury is also contained in these modern lamps. These energy-saving lamps, when they fall down, the fire brigade says all windows open and out of the house for 48 hours. But housewives don't even know that, do they?
Yes, and above all, that would have to be quarantined. Nobody should be able to enter for weeks. Because it's about the mercury vapours.
What are we doing? Sweep it up, put it in a trash can. The trash goes out once a week.
This room should be locked. If it happened in my practice, I would seal this room. I would seal it now, and then no one is really allowed to go in there for weeks. This is very important. Contact lenses have a liquid where they are put. It contains thiomersal. It contains mercury.
What?
Yes.
That can't be true.
Yes, you have to be really careful not to read mercury or thiomersal. For example, health food stores now offer liquids that don't contain mercury.
Oh no, but the mercury comes straight into the eye. It's unbelievable.
Above all, it doesn't become any less in the world. You have to say that. Mercury can't decompose, and it does not become less in the world. In the past, people were burned with mercury. What do you think was spread by the crematoria? And these are all indirect loads that we get from the atmosphere, in addition to mercury. The pollution, especially near airports in cities, through the lead petrol engines for years and decades. The lead everywhere in the cans, the many hobby hunters, and so on. So that's a burden. Joachim Mutter wrote this beautiful book, Don't Let Yourself Be Poisoned.
Yeah, I read it.
That means he gives a lot of information, and he's also such a big contender against the use of mercury. Now in Germany, I believe that amalgam should really be banned by 2023 or 2024, but
until then, it's okay.
But countries like Russia and Sweden have banned it for decades because we actually know about the highly toxic danger. And because, of course, we also know the interactions For example, mercury, cadmium, aluminium, fight for receptors on the cells, but this receptor is for selenium. This receptor is for potassium. This receptor is for magnesium. And the patient goes into a detoxification weakness because the selenium cannot become active intracellularly at all. Or the heart goes into an arrhythmia because mercury sits at the potassium receptor. Potassium and magnesium take care of your rhythm of the heart. Who thinks of an arrhythmia? Who thinks of toxic loads when you think of extra systoles? And those are things where I think it's incredibly important to first identify a burden today. On the other hand, it's incredibly important to do an honest detox as well.
I'd like to come into that straight away, the drainage. We did a test once, a few tests with urine solutions. We sent them to a lab to test for glyphosate. And I'd like to compare the values that we got. The drinking water ordinance says 0.1 micrograms per litre of glyphosate. It's still okay. WHO says over 0.5 is carcinogenic. We had values between 9 and 15 in the urine. So I asked myself, how does all this glyphosate actually get into my body? And that should get us all thinking again, shouldn't it?
Yes, of course. I mean, glyphosate. So whoever read this book by Carson, Silent Spring, that was written in the 1960s, know those who start using herbicides destroy human life and life on Earth. And that's what we know today. That glyphosate in general is now spread systemically across the globe. It takes 6 years for such a bottom to recover. It's massively used in large-scale agriculture.
France has banned it now, early 2020.
I know, and that must also reflect on us humans. And I always think that is miscalculated. Well, we use it, we humans, but we're also the ones who now naturally bear the consequences. And that destroys our entire intestinal microflora. I've never seen so many highly pathological stool findings in the context of a leaky gut, in the context of a permeability syndrome. And that is, of course, also an effect enhancer. When the gut is no longer in its integrity to protect us from all these toxic things, that they are not even absorbed into our body and, of course, becomes ill itself. That can happen for weeks, months, years, without causing me an indigestion, but it's there. Then that means that in the framework of this toxic exposure or glyphosate contamination, we suffer from immense health damages.
Well, it just shows me that we have to take responsibility for ourselves and think carefully about it. Because on the other hand, there isn't a line of business somewhere that's interested in doing marketing to make us aware, to do without these heavy and light metals. Through eating and through drinking, nobody earns money from warning us about these things. That's why I understand it. That's why it's so important that we actively take the reins and say this dirt didn't come into our bodies due to evolution. It all happened within 30, 40, 50 years. How do we get that out again? And now tell me, how do we get it out again?
Yes, we'll get it out again. We'll get it out again to some extent, and we also have to say that just as a contact with a virus does not always provoke a viral disease, it's the same with heavy metals. So the body has a certain amount of strength to compensate. For certain loads, there's no question about it. This silent and mute self-destruction process, which of course takes place because the body can't deal with aluminium, with mercury, with lead. It can't do anything with these things. Of course, this also has an impact on its cellular health. That means I have to prepare my detoxification capacity first. I can't just say I'm using chlorella and high doses of selenium and zinc now and support my liver, my lymphatic system, my kidneys with these things to drain that. That won't be enough. So I need to know first, how are my individual trace elements and everything the liver needs The liver has two major detoxification phases. In phase 1, the first phase is preparing for phase 2. In the second phase, it conjugates, and in these phases, everything must be ready. Selenium, zinc, glutathione, essential amino acids, B vitamins, that this sequence takes place in a completely chronological order. For this, I have to be clear before a detoxification that the liver can do that. In addition, one looks for enzyme deficiencies or also has to look for genetic defects, because we find this again and again in patients who tend to develop Parkinson's very early on, or an autoimmune disease, that disturbances in detoxification have been around for years. And that is very important before you start such a detox. You have to be fully informed about these things. And when you start the detox, you definitely need to be prepared, because you can't bind something and then don't give the liver the opportunity to turn fat solubility into water solubility without problems. And the kidneys can excrete it. In addition, the liver always pours everything back into the small intestine. And of course, chlorella is a wonderful remedy. In a high dosage, chlorella 3 times 1 does nothing at all. But then I have to bind it properly, and we go up to 30, up to 60, sometimes up to 70 of such tablets a day.
You don't say.
Exactly. And on the other hand, by zeolite. The zeolite is a rock mineral from the Andes, which of course has a very high ability to bind, not only for the heavy metals, but also for fungi. For histamine, in order to detoxify again and again, and during these focused detoxification weeks, we also do these chelations. But on the other hand, of course, we take the body with us in this process. For me, it's not enough to loosen the heavy metals and get them ready to be discharged, but that you also help the body to drain them. That means that we then, of course, work with colon hydrotherapy, we work with enemas, we work with local overheating for the liver, so that the liver is well supplied with blood, that everything opens, expands, and that it can force these processes, because the liver is the one who took a lot in too. The kidneys also absorb an incredible amount of heavy metals, simply because they're involved in this process due to the stress. And patients who develop renal insufficiency and also become dialysis dependent are often people who have also stored up these toxic loads in their kidneys for years. This is a very important aspect that you always have to look into when a person also has declining kidney activity. Heavy metals, light metals, aluminium. And we also work with a VitaWave treatment, for example, where the body is wrapped from head to toe, bandaged, wet.
And then frequencies?
Yes, but only at the frequency of the cell membrane potential and the mitochondrial activity of energy powerhouses is increased by a multiple up to 500 times, so that what I have initiated, what I have bound, is now also participating, can be eliminated. I always have to take my body on this journey with me, and patients who now come to this intensive detoxification, sometimes such a week follows when they just had amalgam fillings out and now actually want to have a status quo and say, but now I'm going to detox, which then really follows through a larger process.
I once did the liver detox week with you. It makes sense. After the liver detox, the capacity is there then actually to do the detox.
Sure. There is no question that you need an intact liver organ for this process. And so with a little detoxification and a little here and there, if there is a real burden that we also know that we measure, we can measure what we bound in the urine. That's what you did. But of course we can also measure it in the connective tissue. But then we see the compensation of the connective tissue. And the connective tissue is, of course, what has lasted for years and decades, but what has as part of its task for the organism, also means an immense burden for it. And the body is inclined to perceive things and wants to remove them again, because that's the only way it can regenerate itself. And many, many things of the people who have lived under such great strain, who have really cleaned up, the heavy metals are gone. In some cases, there are still a lot of tooth and jaw problems which are related to it, but who then feel from treatment to treatment what changes can also occur in the body without having this burden in advance. That has something to do with the fact, of course, a toxic load has an immense impact on my immune system, has an immense influence on my body temperature, on my enzyme health, on my hormonal health. Toxic loads intervene in all these areas. High mercury also means being able to develop high blood pressure and developing cardiovascular disease. I don't want to make it dependent on individual illnesses.
But that means that if you have an illness, you would be very well advised to deal with this elimination of heavy metals.
You have to. You can't leave it there. I have heart disease. I have high blood pressure. I have gout now.
I am the victim.
I don't even want to say that, but I really would set out on a journey to understand what happened to me. And today we have to deal with creeping poisons. We have to take care of what we don't actually notice in everyday life. It's frightening when you listen to people. What is normal for people? And the 20 times sprayed apple, well, it can't deliver what I actually get out of an organic apple. Vitality, strength, energy, pectin, so much quality. You have to listen to people sometimes. Or who is now used to their nice bread and, of course, packs up glyphosate without end. Or bisphenol A, the plasticizers in all the plastic. They are xenohormones. It's incredible what we do in this sector.
And put the piece of meat on the aluminium tray and on the barbecue.
Well, of course, bon appetit. I mean, it's all aluminium. And then it's just present and there. And the body doesn't know what to do with it at all.
I still have Dr. Klinghardt in my ear on the subject of brain poisoning that we once discussed, where he said this causality between Alzheimer's, dementia, and a high aluminium load is now actually proven for him.
And what's more, dementia has different forms. But one is, for example, high aluminium exposure. And I can't understand why we don't care. That it is not important to us that we are confronting these issues and looking for solutions from a medical point of view. That we give people the chance to clarify something about the problem. We physicians are called upon to deal with it and give people the opportunity. I can decide that, but that is a very big task, and if we don't start taking it really seriously, then we will face a situation where we are pretty much left alone with our symptomatic therapy and don't change these things in any way.
Well, I do believe that the doctors would be very interested in doing that if they were to learn it from a young age. But that's not something that is simply taught. That this dirt that comes in has to come out again. But it's actually an empirical value from practice, where you can see in the cause analysis that that is the problem. And if you don't have time, you can't solve the problem. And if you take your time, like in a clinic, then of course it's cool if you can solve these problems at the source.
I don't want to say it's just about time. I worked as a country doctor for 20 years, and it was incredibly important to me to clarify that people as well, because I wanted to find a way for them. And then you come closer and closer to these questions, because the knowledge is open to every doctor today. As a doctor, I just have to become aware of it, and you're really right. Well, we have to think medically. Every student today has to be a little environmentalist, because no matter what specialty they go into, They need to have the knowledge that what's presented to them as a disease is always the sum of the whole and means the decompensation of the body. And if I don't start there, then of course won't be able to treat Parkinson's, and I can't treat MS either. And I may be able to lessen the episodes, but I can't claim to be able to change something fundamentally in this clinical picture, because I'm not at all interested in the causes that have led to it. And that's a trend that's really sad for me to watch. The youngest MS patients are 27 years old, and that's a generation that says, I want to do something. I want to get involved 100% and give my body a chance. This is a generation that recognises the helplessness of medicine, which has been doing it the same way for over 70 years and doesn't want to be understood as that, but rather as the person who now also has a real concern to change something about this problem.
I still have you in mind in another episode where you talked about the inuspheresis, and at Christmas, after a detox, a blood wash, a lady who had dementia and hadn't spoken for years.
6 years.
6 years, and after that she...
Already, after the first, I just want to tell you what is possible.
These are miracles.
And that we don't even make these people feel that we understand why they have dementia. Because even if we don't know anything, we do know today what has to happen for a tumour to develop. We know what has to happen for dementia to develop. And we pretend medically that we judge the end result of that, but that we don't know. And that's not true. So then I think we should network much better on an interdisciplinary basis so that we mutually exchange these experiences and make paths that lead out of there are also walkable, and that we don't work in isolation from each other. I think it's totally important, also very, very elementary and meaningful, that we take care of the questions.
Thank you very much, dear Petra. And you, dear viewers, if you have further questions on this subject or have a direct question for the Chief Physician, Dr. Petra Wiechel, then you'll find the contact details for us or for her on our website, QS24.tv. Write to us. Then you can get more information, or you'll be given sources on how you can continue to deal with the topic. For example, if you have any disease symptom that you would like to have analysed, then also go on QS24.tv, simply enter your topic in the search term and you'll immediately be taken to other shows. Maybe also right away with Dr. Petra Wiechel, with whom I've been able to do so many shows. We wish you much, much success. Good luck in your search for such programmes with a broader view, a broader perspective to the conventional view. That's it for today. I wish you all the best, the very best. See you next time. Bye-bye.